My name is Mary. This is my week 4 interactive assignment, the psychological assessment meeting with Ms. S. The introduction. Hello, Ms. S, and welcome. My name is Mary Rice, and I work as a psychologist at the North Dakota State Hospital. I worked with inpatient services as a psychologist for 6 years. It appears that you have been analyzed for concerns about attentional functioning. Thank you for meeting with me. I am here to assist you and provide information to you from your assessments and what could benefit you in your future. This information is confidential and is only accessed by you. Now let's get started. Basic information. From the information that I received, you are a 29-year-old female. Reviewing your tests from your history, you have not used drugs or you do not drink alcohol. It's also reported that you have acute stress, generalized anxiety disorder, GED, from a situation in the Army that could possibly lead to PTSD. You possess strengths that include no problems with development since birth, and you are career and goal-oriented with attending a local school and working as a fitness instructor. Please feel free to let me know if you have any questions. Testing summary. As far as your general functioning scores are listed as the WAIS-5 from a full-scale IQ, such as verbal, perceptual, reasoning, processing speed, and working memory range from low to average. Attention processing speed ranging from WAIS-5 according to Stroop Kohler word score and consistent as of average to high average. The low average score was WAIS-5 arithmetic and rough 2 and 7 total speed. Receptacle scores, black design, low average, and target cancellation time errors are within the normal limits. Language was rated from low to average and vocabulary to average in information. Your memory levels range from mild impairment from the Learning Trial 1 to low average or average in interference trial and visual tests. Executive information range from average to mild impairment in the WCST categories, 64 cards. Testing summary continued. The wide range achievement test 4 reflected that you were average in word reading, sentence comprehension, spelling out house severe impairment in mathematics. Future assessment. From your history of generalized anxiety disorder, GED, acute stress, and factors similar with PTSD, post-traumatic stress disorder, I would like to complete 2 more assessments for PTSD. Even though you scored average in some areas, your impairments are consistent with mathematics, stress, and memory. The areas for assessment will specialize on future achievement. Some signs and symptoms of PTSD include irritability to noises and sounds, life-lasting trauma, withdrawn from relationships, withdrawn from work or academics, future health problems, short and long-term memory loss, possible stress, anxiety, or depression. What assessments would benefit you? Ms. S., I believe with further assessments of PTSD, I would like to explore and provide you with some more research and answers to assist you in your future. The 2 assessments that I would like to provide are 1. PTSD Symptom Scale Interview. This is a 17 semi-structured type of interview that is used for assessment and diagnosis. It reflects upon a certain experience that could provide current distress. It takes about 20 minutes and is a questionnaire interview type. The second would be the structured clinical interview, an interview type that provides studies that may include other similar diagnosis with PTSD. It takes about 15 minutes or several hours depending on the trauma and information that is shared. This is dependent on someone's history. What do I recommend for you? In my professional experience, I would recommend a few things that may benefit you. There are self-reports available, resources online, and phone numbers for professional and quick assistance, possible treatment groups that may benefit you. Medication is also an option, and perhaps a therapy animal. A few notes. Also, if you have an emergency, contact your cell phone. Type of distractions, such as games or puzzles, or physical activeness, continue to help people. And these are my references. I hope you didn't mind my coughing or sniffling. I'm just getting over the flu. So thank you for watching.